Mr. Nolan, great to see you. Thank you very much for coming for your 3-month visit. So we are very glad. I heard that you're doing well, but I want to hear from you. So please let us know how your thumb feels.
My thumb feels great. And I'm so excited because I had a trigger finger in that same thumb, and the trigger finger has not come back.
Fantastic.
And the thumb the pain's gone.
Fantastic.
It's totally gone.
And overall, how would you describe your experience with the embolization procedure?
It was easier than I thought it would be. It was quicker than I thought it would be, even though I had read all about it. I just came in, got it done, waited an hour or two, and off I went.
There you go. What were you not able to do before this embolization procedure with your left hand?
Anything that made me have to use the whole hand, like to hold a ball, or play the piano, or hold the hair dryer to dry my hair,
yeah.
or all those kinds of things.
So just things that you would normally do during a day.
Right. To hold the towel, to get my back dry.
Right. Right. And what are you able to do now better?
All of it.
All of it. Wonderful. So do you think now if you started playing the piano again, you'd be able to do it pain-free?
Sure. Yes.
That's incredible. That's a great story. There are people like you living with chronic musculoskeletal pain. And what message do you have for them? There's obviously fear and anxiety around new procedures, but what message would you have for, say, a friend or a neighbor who's suffering with similar pain? What message would you have for them?
Funny you should ask me that today, because I was just with a friend yesterday from Indianapolis, Indiana, who came in with what do you call those things, a wristband. And I said, "What happened to you?" And he said, "Well, I've got this pain in my thumb." And he said, "It just keeps hurting and I can't get rid of it." And I said, "Boy, do I have the idea for you." So I explained it to him.
Excellent.
I said, "So do they do that? If they don't do that in Indianapolis, you can come back here, you can spend one day, and you can fly right back to Indianapolis."
So if you had to send a message out, would you say that the procedure is relatively simple on your body, number one? Number two, that there's nothing to be afraid of because it's a minimally invasive procedure, hardly took about 10 minutes or so, and your recovery wasn't bad at all because you didn't have any stitches or any incisions.
Right. Well, all of that is true. It's fast. It's not uncomfortable at all. I don't know why, but I had a lot of confidence in you.
Thank you. Appreciate that.
And so it was just a very simple, easy procedure.
Excellent.
Yeah.
Excellent.
And the non-invasive part was really good. That's
Excellent.
what drew me to this in the first place.
Glad to hear that. Well, thank you for your time, Ms. Nolan. I think you may have helped a few people today.
I hope so.
Thank you, dear.
I hope so.
Thank you so much for your time.